The biceps femoris of the hamstring group has two heads, a long head and a short head. Both heads cross the knee joint, only the long head crosses the hip joint. The long head attaches proximally to the ischial tuberosity, which we can palpate easily right here. From there, it goes down to attach distally to the head of the fibula here. To engage the biceps femoris, we partially flex the client's leg at the knee joint. We then ask the client to perform further flexion of the leg at the knee joint against our resistance. This engages the muscle, and we can strum across it perpendicularly as it's contracted. As the client alternately contracts and relaxes this muscle, we can follow it distally toward its distal attachment on the fibula. In the distal posterior thigh, the biceps femoris gradually narrows, and approximately here it will become tendon and is very often visible as well as palpable. Here we can pinch the distal tendon as it continues to cross the knee joint and attach into the head of the fibula. The short head is palpable just lateral to the long head in the distal posterior thigh. To locate it, we first locate the distal tendon of the long head and then drop lateral onto the short head. We then ask the client to engage the biceps femoris by pressing his leg into flexion at the knee joint against our resistance, and the short head can be felt to clearly contract. We then follow it proximally, strumming perpendicularly across the fibers. To discern the border of the biceps femoris from the vastus lateralis, we need to find this border. The vastus lateralis is located anteriorly approximately here. To discern the exact border, we can use flexion and extension, flexion seen here, and extension of the leg at the knee joint. When the client flexes the leg, the vastus lateralis will remain relaxed and soft, and the biceps femoris will be contracted and hard. And when the client extends the leg at the knee joint, the biceps femoris will remain relaxed and soft, and the vastus lateralis will contract and harden. So we can discern the border between these muscles by using actions of the leg at the knee joint. Flexion for the biceps femoris and extension for the vastus lateralis. The distal tendon of the biceps femoris can also be located with the client positioned like this. We can usually visually see it. If we then ask the client to laterally rotate the leg at the knee joint, then this engages the muscle and it becomes even more visible and palpable. Here we see contraction and palpation of the distal tendon of the biceps femoris muscle. The semitendinosus is one of the medial hamstring muscles. It attaches proximally to the ischial tuberosity here. It then runs distally and veers medially to cross the knee joint and attach onto the pes anserine tendon on the tibia here. The semitendinosus flexes the leg at the knee joint, so we can use this action to engage it. We find the ischial tuberosity and then drop off it distally, and we ask the client to press his leg against the resistance of our hand, and we can feel the semitendinosus engage. We continue to strum perpendicularly across it and palpate it in baby steps distally as the client alternately contracts against our resistance and relaxes the muscle. In the distal thigh, the semitendinosus becomes tendon, and this tendon is often visible as well as palpable. Here in this client, the distal tendon is visible. We can palpate this distal tendon, strumming across it, and then follow it across the knee joint as the client flexes the leg against our resistance. We can continue to palpate this tendon all the way to its distal attachment at the pes anserine tendon, which is located here on the proximal anteromedial tibia.